Hello, my name is Michaela. I am a nursing student with OCC. I'm just here to do a little assessment on your newborn today. I'm just going to start by doing some hand hygiene. Next, I'm just going to compare your wristband to baby's wristband, make sure they match, and they do. And then I'm just going to put on some gloves for this. And while doing this, I would make sure the baby stays underneath a radiant warmer so the baby stays warm during the assessment. First, I'm just going to start off with taking a baby's heart rate, and I'm going to do that by taking the apical pulse for 1 full minute. And normal for babies is 110 to 160 or 120 to 160 beats per minute, and babies is 138, so that is normal there. Next, I'm just going to take a look at baby's respirations. You can either do that by looking, feeling, or listening. I'm going to do it by feeling, and you're also going to take it for 1 full minute. And baby's respirations should be 30 to 60 breaths in 1 minute, and baby's is 38, so we're normal there. Next, I'm just going to take a listen to baby's lungs. Okay, baby's lungs sound clear bilaterally. Babies have a little bit of a irregular breathing pattern. Sometimes they breathe a lot and then they'll have a pause and then they'll breathe a lot some more. That's completely normal. That doesn't mean that they're having a hard time breathing. That's normal for newborns. But some signs, if they did have trouble breathing, would be if their nostrils were flaring, or if you notice that they're getting a little bit blue, like around their mouth or their hands or their feet. That would be a sign that they are having some trouble breathing. Also, if you notice increased respiratory effort, like if they're breathing really fast or trying to breathe really fast, that means that they're having trouble breathing. Or if you notice some muscle retractions in between the rib bones, that's also a sign that baby's having some trouble breathing, and you would want to get the nurse or call the doctor to get a look at baby, because that means baby's having a little bit of hard time breathing. Next, I am just going to make sure that baby's temperature is good. We are going to take this axillary, so that would be in the armpit, and it's going to go parallel to the body, and you're going to close the arm to make sure you get a good seal on that. So we're just going to put the temperature in the armpit there and then close it. And baby's temperature should be 36.5 to 37.5 degrees Celsius, and baby's is 36.9. So we are normal there. Next, I am just going to take a look at baby's overall appearance and posture. Baby looks nice and relaxed, and the movements are equal and bilateral in all 4 extremities. One is not moving more than the other, and they're nice and equal. And baby's skin looks nice and pink. No signs of jaundice or acrocyanosis in the hands and the feet. And next, I'm just going to take a look at baby's fontanelles, so the anterior and the posterior. So, just gonna take baby. Sorry, baby. And we're just going to do the anterior, which is here, and the posterior, which is back here. And we're just going to feel those. And we want them to be soft and open and flat. No bulging in those fontanelles, and babies are soft and open and flat. Next, we're just going to feel baby's head. We are feeling for any signs of any cephalohematoma or any caput saccadium, so like any swelling in the head caused by either fluid or blood. That is sometimes can happen with the birthing process, but baby has no signs of that. The head is normocephalic, so we're good there. Next, we're just going to take a look at baby's clavicles. So we're just going to feel both of the clavicles. We're feeling for any bulges or masses or any signs of crepitus or anything that's on one but not the other. And both of baby's clavicles are intact, so we are good there. Next, we are just going to take a look at baby's abdomen. And baby's abdomen looks nice and soft and rounded. And next, we're just going to listen to baby's bowel sounds. Okay, and baby's bowel sounds are active in all 4 quadrants. Next, I'm just going to take a look at baby's umbilical cord. And we want the umbilical cord to be above the diaper line. So diaper line would be down here, umbilical cord here. We want that to be exposed, not underneath the diaper line. So we're going to want to make sure that diaper is folded down and the umbilical is exposed. And want to make sure there's no signs of any infection and that it's drying nicely. And it is drying nicely, and there's no signs of infection of this umbilical cord on this baby. Next, we are just going to take a look at the vertebrae alignment. Make sure everything is in line and baby's is in line. And then we're just going to end with that sacral dimple just to make sure that that's nice and closed up. And it is on baby. Next, we're just going to take a look at baby's genitals. So this is a male, so we're just going to be looking to make sure that the urinary opening is on top of the meatus and it's not above or below, which would be epispadia or hypospadia, and baby's is normal, it's right on top. For a female, you just want to make sure that all of the folds are closed and the labia majora is closed by those folds. And next, we are just going to be taking a look at baby's reflexes. So we're going to start with the grasp reflex. So that's when you take baby's hand, you put your finger in their hand, and they grasp it. So we're going to take our hand, put a finger in the hand, and then they grasp it. Next is going to be the Babinski reflex. So that's where you take baby's foot and you rub something hard along the outside, and baby's toes should splay out and back. So you rub and baby's toes splay out and back. Next is going to be the Moro reflex, which is the startle reflex. So sometimes you can just take baby and just make them think that they're falling a little bit, and then their arms should go out and then come back in. And then we're going to do the stepping reflex. That's where you hold baby up and they act like they are going to be stepping and walking. So baby has all of those reflexes. And then the last one is going to be the rooting reflex. That's where you take your finger, put it by their mouth, and they're going to go towards that finger. So we're going to take baby, and we take that finger, put it by baby's mouth, and then they're going to turn towards the finger to try and grab it. Okay, and then we're just going to do a little bit of teaching. We're going to start off with some safe sleep teaching, which is going to be the ABCs. So that's going to be A for alone. We want baby to be alone while they're sleeping, no blankets or toys or people around them. We want to make sure that baby is B for on their back. And we want to make sure baby is C in the crib. So we want baby to be alone on their back in the crib. No blankets, toys, people around baby. Next, we just want to make sure that baby is eating well. So in 24 hours, we want to make sure baby is eating at least 8 times. In the first 24 hours of life, baby should have 1 stool and 1 urine. In the next 24 hours, so 48 hours, baby should have 2 stools and 2 urines. And then 3 days and longer, baby should have 3 or more stools and urines per day. And those stools are going to be changing over those couple of days. You're going to start off with meconium, which is the first stool. That's going to be a black tarry substance, real sticky. Then it should go to transitional stool, which is going to be a little bit more light green, dark green. And then it's going to be a little bit more liquidy. And then it should move into milk stool, which is going to be a more yellowish, liquidy, there might be some chunks in there. And that's totally normal. That means baby is eating nice and well. And then baby is going to lose a little bit of weight over the first week of their life. That's totally normal. And then they should start gaining that weight right back after the initial weight loss. And then next is just some signs that you're going to want to report to the nurse or the doctor. One would be if you notice your baby feels warm or if your baby has a fever, you're going to want to let the nurse or doctor know right away. Next would be if you notice that baby is having looking like they're tan or any yellowing of the skin, you're going to want to call the nurse or doctor for that. And also if you notice any blood in baby's urine or stool, you should call the nurse or doctor if you notice anything like that. Next, I'm just going to show you how to stop a baby from choking. So babies are prone to choking. They have immature muscles. That's just normal. That just happens. So when a baby's choking, you're going to want to hold their head and hold them down. So you want their head here, their body here, they're laying on their stomach. And then you're going to want to take the palm of your hand and go ahead and hit baby's back in a downward motion to try and get them to dislodge what is choking them. So you're going to want to hold baby, make sure their head is down, and then be hitting that back. I'm not going to hit you. And be hitting that back to dislodge whatever they're choking on. It should come right out. Usually doesn't take much. Next is going to be how to make sure that you're doing lots of skin to skin with baby safely. Skin to skin is very good for newborns. It helps them regulate their temperature because they have a hard time regulating since they're so new to the world. So you want to make sure that baby is within kissing distance on you, which with as much skin contact as possible. And you want to make sure that you're able to kiss baby so baby's not too low or too high. So make sure you can kiss baby. And that is going to be the end of my assessment on your newborn. Thank you for letting me assess them. And then when I leave baby, I would make sure baby gets nice and wrapped up again in the blanket, re-swaddled, and make sure baby is alone in the bassinet. And thank you for letting me assess your newborn.